I wasn't always the biggest advocate for patient safety. I think like a lot of healthcare providers, I really didn't realize how big of an issue this was. And someone asked me, Dr. Mills, what are you doing about medical errors? At the time, I was the public health director for the state of Maine. And I said, like a lot of people did at the time, I said, well, you know, that data, the 44,000 to nearly 100,000 deaths every year due to medical errors, you know, that was based on sampling something like 17 hospitals in about 3 states. So, you know, we're not really sure it's that many. And she looked at me and she says, well, how many do you think it would be then if that sampling was not that accurate? And I said, well, you know, probably in the lower end, like towards 44,000. That encounter was only a couple of days after I had provided testimony in the state legislature for strengthening our seatbelt laws. Nationally, there are about 40,000 deaths on our roads due to car crashes. And one of the leading causes is the fact that we don't have good seatbelt laws. And the 44,000 figure of being the low ball of how many people die from medical errors, being so close to the 40,000 who die from car crashes, stopped me dead on my tracks. It was too ironic to me. And suddenly I realized that patient safety was indeed a huge issue in our country. Subsequent studies even have shown that number to be closer to 180,000 deaths. So here we are, and we're tolerating somewhere between 100 and 180,000 Americans every year dying from preventable reasons in the healthcare system. And where is the outrage? What's very pronounced to me is that 80% of those deaths have in common root causes of poor collaboration, poor communication, or poor coordination. And really, what they're talking about with those 3 C's is poor teamwork. So that's how I've come around to realizing that what we're doing with interprofessional education, whose goal is to produce collaborative-based teams, is so critical.